welcome back to another video of Medic Notes. This video will be on major depressive disorder, or commonly known as depression. Depression is a very common and serious mood disorder that affects the way how an individual feels, thinks, and acts on a daily basis. It also goes by the name major depressive disorder, MDD, or clinical depression. The causes of depression are a lot of causes, where some of the causes, studies have shown that it can be due to genetics, including family studies, where it is shown to have an 40 to 70% chance of developing depression if a first-degree relative suffers from depressive episode. Organic causes, such as physical illness like Cushing syndrome, Addison disease, Parkinson disease, or other common illnesses such as stroke, heart disease, and hypothyroidism can also cause depression. Medications like corticosteroids, oral contraceptive pills, beta blockers, and others have shown to cause depression in some cases as well. Other causes include psychosocial factors such as adversity in childhood, for example, maternal loss, where they lost their mother since young, or poor parental care, or even overprotection among the parents, and if they had physical or sexual abuse in their childhood. Adversity in adulthood, for example, for women, if there is absence of a confiding relationship, or for men there is unemployment or divorce, can also cause depression. Recent life events such as loss of a child, death of a spouse, divorce, imprisonment, or recent death of a close family members. These are some of the causes of depression as well. Presence of cognitive errors such as magnification, where one has the tendency to magnify their failure and also forget all their previous successful events. Overgeneralization, generalization of failure in their life compared to other areas of life, and also personalization, where one feels that they are entirely responsible for the failure and dismiss the role of other individuals in the responsibility of the failure. So these are the etiology of depression. Let's take a look at the DSM-5 diagnostic criteria for depression. So the criteria to diagnose one as having major depressive disorder, they have to have at least 5 of the following symptoms for a minimum duration of 2 weeks. So the symptoms include two core symptoms are low mood for most of their days and diminished interest in almost all the activities. Other symptoms include weight loss, more than 5% of the body weight. Sleep difficulties can be insomnia or hypersomnia, which is unable to sleep or sleep too much. Psychomotor changes such as agitation or retardation, low energy almost every day where they feel fatigue every day, feeling of worthlessness or guilt, attention and concentration difficulties, and suicidal ideation or self-harm events. And the symptoms should have caused marked impairments to be diagnosed as major depressive disorder. So out of these symptoms, at least 5 of the symptoms are faced by the patient for a minimum duration of 2 weeks. Then we can diagnose them as having major depressive disorder. The investigations include routine laboratory tests such as full blood count, ESR, vitamin B12 and folate, renal function tests, liver function tests, thyroid function tests to rule out hypothyroidism, and also calcium panel and parathyroid hormone levels. Further investigation to find out the cause include urine drug screening to rule out substance abuse causing depression, urine FEME and urine culture, especially for elderly, to rule out urinary tract infection causing the depressive symptoms, thyroid antibodies, especially for those with abnormal thyroid function tests, to find out the cause of the thyroid dysfunction, anti-nuclear antibody in suspected cases of SLE, syphilis serology, HIV testing, and also CT or MRI of the brain to rule out space-occupying lesion, such as brain tumor or other causes that could have caused the change in their behavior. These are the questionnaires for depression to diagnose depression, which include back depression inventory. It is a 21-item self-rated instrument to measure the presence and the degree of the depression in adolescents and also adults. Another scale is the Hamilton Depression Scale, and another one includes the Montgomery-Åsberg Depression Rating Scale. So these are some of the scales that measures the degree and severity of the depression symptoms. For treatment of depression, the aim is to achieve symptomatic remission of all signs and symptoms of depression, restore the occupation, and restore the psychosocial functioning. So initial treatment can be divided into non-pharmacological and pharmacological treatment. For non-pharmacological, counseling and supportive therapy may benefit the patients who have only mild depression. And if sleeping is a problem, we can offer sleep hygiene advice. Psychotherapy may be considered as first-line treatment in patients who are reluctant to start medications or patients with comorbid medical conditions who may be unable to tolerate the antidepressants. Hospitalization may be required if the patient shows a high risk of suicidal ideation. Whereas for pharmacological treatment, the first-line treatment would be the SSRI, which is the selective serotonin reuptake inhibitors. And some examples of the medications include fluoxetine, fluvoxamine, sertraline, and also escitalopram. So we have to inform the patients that this antidepressant, this SSRI, will take around 4 to 6 weeks to achieve their effect. Explain the side effects to the patient, and monotherapy with a single antidepressant is recommended. Another type of pharmacological treatment is the tricyclic antidepressants. However, it must be avoided in suicidal patients due to its lethality in overdose cases. So, for the treatment, there is the acute phase, which is for 12 weeks, and also the stabilization phase. During the acute phase, monitor all the patients who recently started on antidepressants. Monitor them closely for any increase in agitation and suicidal behavior, especially young patients younger than 25 years old. There is a higher risk of suicidal ideation. Some of the symptoms, such as sleep and appetite, may improve more quickly. And if after giving the medication, if there is only partial response or no response, then we can consider to increase the dose of the medication or consider to switch to another antidepressant. The first line would be an alternative SSRI, and second line, we can give antidepressant from a different class. Whereas for stabilization phase, after the acute phase, the antidepressant should be continued for at least 6 months. And if a patient needs to stop the medication, stop it gradually over a 4-week period to avoid those discontinuation symptoms such as anxiety, giddiness, flu-like symptoms, nausea, or even insomnia, where they are unable to sleep at night. So that is all for this video. Thank you.